My name is Dr. Jacqueline Kitulu. I'm a general practitioner for the last 24 years. I have today partnered with Ponea Health on this educational video on diabetes mellitus. Number 2, in lifestyle modification is activity, exercise. So remember, we said sedentariness is what also predisposes you to diabetes. So we want to have diabetics being active. And what is the recommended exercise? We're saying minimum of 30 minutes most days of the week. So most days is 5 and above. So that in that sense, we want a cardio activity, something that raises your heart rate, makes you a little breathless. What that does is that it requires oxygen and glucose to be consumed. So it enables that extra glucose to be burnt. So in the exercises that will do that, brisk walking, jogging, swimming, cycling, all those are fantastic for improving your blood glucose control. And 30 minutes is the minimum. It's not the maximum, it's the minimum. And you build up on that. Then number 3 in lifestyle, of course, is also looking at weight management. So especially for those who are overweight, because remember I said being overweight or obese increases or predisposes you again to the diabetes. So weight management. And a lot of weight management, of course, is related to diet and to exercise. So ensuring that one stays within the BMI for their weight, BMI being the body mass index, and that can be calculated by your doctor. But there's a range that is safe for your height and your structure. So those 3 critical things: your diet, your exercise, your weight management, cut across in terms of diabetes management, for be it type 1 or type 2. The fourth issue, which would be slightly out, and I'll just place it here because it could cut across, is in terms of in the management is also care for the diabetic. That because there are several complications that may arise, so issues like foot care, issues of looking at the eyes, looking at the skin, because as we talk about complications later, you'll understand why those are important in terms of managing a diabetes patient. Then finally, let's get to the type 2 diabetes, because type 1, we've talked about the need for insulin. We've talked about the general care that applies to both type 1 and type 2. And then now for the diabetic type 2, the lifestyle change and during the initial diagnosis, you find that some of the patients, the blood sugar is just slightly raised, that's 7.8 or 8, millimoles as a fasting sugar. And these are the ones that sometimes we actually start with just lifestyle modification, so that you're looking at adjusting their diet, their weight, and their exercise. And for some of the patients, that's just good enough to get them back to a normal blood glucose. A vast majority of the type 2 diabetes patients, however, will be some sort of what we call oral hypoglycemic agent. So I'm using some of these big terms because you'll come across them. So it's good for you to know them. So, and an oral hypoglycemic agent, what is that? It's just a drug that lowers the blood glucose. So, and these are drugs which in most cases are oral, so they're swallowed, and they come across in various classes. I will not talk into the details of the classes because your doctor will decide what is best for you. But these are drugs which will be taken sometimes once a day, sometimes twice a day, and they work in different ways. Some of them just make the tissues where the glucose is going more sensitive to the little insulin that's available, so that then the blood glucose moves there. Others also stimulate the pancreas to produce a little bit more insulin. So that is where the vast majority of type 2 diabetics will be, on what we call oral hypoglycemic agents. Then there's a small minority who will also require insulin despite being type 2. And why will they require insulin? Remember, we talked about the reason why they have diabetes in the first place is that the pancreas is not producing adequate amounts. So no matter what you do, it continues, for many of the patients, it continues to reduce production. So at some point, some of them, you'll find there's not, there's no matter what oral medication, it's not sensitive enough, then you add insulin onto their treatment. And the insulin added to the type 2s will vary. Some of them will just require an insulin at night, what we call a basal insulin, and then together with their oral drugs. A few others may actually require even daytime insulin, but all those are details which will vary from patient to patient, and your doctor will discuss that with you. So thank you very much for having joined in this series, listening to hypertension and diabetes. It has been my pleasure empowering you to manage your hypertension or diabetes at home. You can reach me through ponea.com for my services for managing your hypertension or diabetes. Carry on.